Hello everyone, let's solve some pharmacology MCQs. So the first question is, a patient with MRSA bacteremia develops Redman syndrome after rapid administration of a drug, and the question is which drug caused it and what can be done to prevent this. So the first option is linezolid. We all know linezolid causes bone marrow suppression and optic neuropathy. So this cannot be the answer. So the next answer is vancomycin. Vancomycin, when administered rapidly, by rapidly we mean 1 gram is administered within 60 minutes or more than 10 milligram per minute. So this causes activation of mast cell and basophils. So this releases histamine. This histamine causes flushing, pruritus, erythema and hypotension. So this is known as Redman syndrome, and it can be prevented by prior administration of antihistamines like diphenhydramine 25 to 50 milligram orally or intravenously, and we can prevent this by administering drug over 1 hour, not within 1 hour. Okay, so the right answer for this question is vancomycin, and it can be prevented by antihistamine pre-medication. The next option is daptomycin. It causes myopathy. And the next option is clindamycin, which causes pseudomembranous colitis. So it is non-Ig mediated reaction, not allergic reaction. So it is not anaphylaxis, it is anaphylactoid reaction. Redman syndrome is anaphylactoid reaction. So the next question is, which of the following beta blockers possesses additional alpha-1 blocking property? Okay, so the first option is atenolol. We know atenolol is beta-1 selective or cardioselective beta blocker. So it is cardioselective beta blocker. So this cannot be the answer. Next answer is metoprolol. Again, metoprolol is beta-1 selective. So it is not having any alpha-1 blocking property. So this is ruled out again. So we have carvedilol. Carvedilol is not beta-1 selective or cardioselective. It is blocking beta-1, beta-2 receptors and alpha-1 also. Alpha-1 is located on vascular smooth muscles. Okay, vascular smooth muscles. Blocking this causes vasodilation and decrease in BP. So this is used in congestive heart failure, where it reduces preload by blocking alpha-1 receptors on blood vessels. Okay, so the right answer for this question is carvedilol. Bisoprolol, again, it is beta-1 selective or cardioselective. Other beta-1 selective or cardioselective drugs are esmolol, betaxolol. Okay, so these are cardioselective beta blockers. The next question is, which statement about proton pump inhibitors is true? Okay, so the first option is they inhibit gastric acid secretion by blocking H2 receptors. No, this is not the mechanism of action of proton pump inhibitors. H2 receptors are blocked by drugs like ranitidine and famotidine. So this cannot be the right answer. The next option we have is they irreversibly inhibit H plus K plus ATPase pump. So this is a mechanism of action of proton pump inhibitors. So this is true for the question, proton pump inhibitors. So the next option is they have rapid onset of action within 1 hour. No, they require at least 1 to 2 hours for initial onset of action, and peak effect is seen in 2 to 4 days. Okay, so again this option is ruled out. Their activity is independent of gastric pH. No, because they are activated. See, these proton pump inhibitors like pantoprazole and omeprazole are prodrugs. They are prodrugs and they are activated by acidic pH. So that's the reason we administer them 30 to 60 minutes before a meal, because food will interfere with their activation and they fail to suppress acid secretion. That's the reason proton pump inhibitors are given 30 to 60 minutes before meal.